Rwanda today joined the globe in commemorating World Malaria Day this Sunday at the Malaria Health Center in Bugesera district. Health experts and researchers explained to the people how mosquitoes breed in swamps and ponds, as well as visiting people who were spraying their houses with mosquito repellents in a bid to prevent malaria. Those that are currently suffering from malaria and those that have recovered acknowledge that this is indeed a dangerous disease. I got malaria and I was in critical condition. I could even feel my brain was affected. I would encourage everyone to sleep under a treated mosquito net and not keep bushes and stagnant water around. A malaria awareness campaign was also launched this week, and drones are being utilized to deliver messages to up to a 3-kilometer radius. Health counselors play a great role in treatment and awareness of malaria, with 60% of malaria patients being treated by health counselors and 40% by doctors. The Director General of the Rwanda Biomedical Center, Dr. Saben Sanzimana, says that while there's been a significant reduction in malaria cases, there are efforts to strengthen the measures against malaria, and they are to continue and should be everyone's initiative. We need to continue being vigilant. What helped and contributed to the reduction of malaria cases, even during the pandemic, is different authorities work together, especially the health counselors who are treating people from their homes, as well as spraying them. We are continuing with the efforts, and there are even new ones, including spraying mosquito repellents using drones. This is something we started last year, which helped as well. But malaria is still around and is still killing people. We should be vigilant. Dr. Sabe also says the fact that the malaria vaccine has reached a 75% rate also gives hope that malaria can be eradicated. That rate is 75%. The other vaccines we've seen in the past have had lower rates than that. But recently, a group of researchers from the Oxford University, with partners in Burkina Faso, released their findings of their vaccine efficacy possibly being at 77%, which is why we have hope that we can get a malaria vaccine in the near future. Dr. Kasonda Mwenda from the World Health Organization Rwanda assures that the United Nations will continue to work with Rwanda to fight against malaria.
So the measures that have been ongoing to be able to fight the disease need to be continued to fight against malaria. And as citizens, as people living in Rwanda, let us endeavor to follow the guidance that we get from the ministry leadership, from the different sectors, and also from the community health workers who we saw here with us today. Countries trying to study what else needs to be done to get to zero malaria. So we work hand in hand with the government and other partners.
Rwanda Biomedical Center estimates that the number of malaria cases has dropped dramatically from 3,600,000 malaria cases annually in 2019 to 1.8 malaria cases by 2020, while the number of deaths from malaria in Rwanda has dropped from 248 in 2019 to 148 in 2020. Reporting for RTV, GLORIA MUTESI.